Are you currently on an ACA marketplace plan and turning 65 soon and wondering what your next steps are supposed to be? In this video, I'm going to walk you through 5 simple but very important steps to move your ACA plan into Medicare. And more importantly, I'll explain to you why it matters. Because if you miss this, you could end up owing thousands of dollars back to the IRS, or you can even lose coverage without any warning. Hello, my name is Edwin John Rodriguez, your health insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients help understand, compare, and enroll on plans that fit their needs and budget. I often say to my clients, I'm the best free help you'll never pay for. Now let's get into it. Step number one is going to be to understand when you're eligible for Medicare. You become eligible for Medicare when you turn 65, or if you've been on disability for more than 24 consecutive months. In this video, we'll focus the message being geared more towards clients who are turning 65, but if you become eligible for Medicare through disability, your window to take action is going to be the same. Once you're initially eligible for Medicare, you'll have a 7-month initial enrollment period, which includes 3 months before your birth month, the month of birth, and then 3 months after your birth month. Now, for this example, let's say your birthday is in October. You can apply for Medicare starting as early as July, and your coverage will begin as early as October 1st. Even if your birthday isn't until the end of October, your Medicare will actually begin on the first day of the month you turn 65. And why this matters is because if you're still enrolled in an ACA plan and you're receiving subsidies through the marketplace after your 65th birthday, you may have to pay back some of the subsidies for the months that you were eligible for Medicare but had stayed on your ACA plan. The reason being is that both plans are federally funded. And if you're entitled to Medicare, you're no longer eligible for ACA subsidies. So it's important to be timely in this process, which brings us to step 2, which is enroll into Medicare Parts A and B. Once you're eligible, the next step is to sign up for Medicare. Again, you want to do this about 3 months before your 65th birth month. If you're drawing Social Security prior to turning 65, you'll actually be automatically enrolled into Medicare as of your 65th birth month, and you don't have to worry about applying for your Medicare through Social Security. If this is your case, you can skip this step and go straight to step 3 of this video. For those not collecting Social Security before turning 65, you'll need to apply through the Social Security Administration and enroll into your Medicare Parts A and B as of your 65th birth month. We have another video we'll link in the description below outlining the steps on how to apply for your Medicare. Essentially, you can do it one of 3 ways. The first option is to apply online at ssa.gov/Medicare, which is the easiest and fastest way. The second option is to apply over the phone, if you don't mind being on hold for over an hour plus, of course. The third option is to apply in person at the Social Security office. I recommend doing this if you enjoy long lines and feel like you're standing in line for a meal at a soup kitchen. I'm just kidding. Just do it online. Make your life easier. You'll thank me later, I promise. And of course, if you need some guidance in this process, please feel free to reach out. My team and I are here to help. We can help you actually apply online. A few simple steps, just takes a few minutes. So when applying for Medicare, you'll want to enroll in Medicare Part A, which is your hospital insurance, which is usually free. And in most cases, you're actually automatically enrolled into Medicare Part A as long as you work 10 years within the United States. The Part B portion of your Medicare is your medical insurance. Now, most people will pay about $185 per month for their Medicare premium, and now that's as of 2025. Here's a pro tip. Before you can enroll into most Medicare plans, whether it's a supplemental plan or an advantage plan, you need to have your Medicare Part A and B in place. Think of the Medicare A and B as the foundation of your coverage. Without that, you won't be able to build off of that coverage. Now, if you're feeling a little overwhelmed, no worries, we've got you. We'll link our bird's eye view of Medicare, which will give you a nice high-level view of the Medicare industry, helping you understand what Medicare is and what your options are when it comes time for your Medicare to go into effect. It's a perfect next step if you're trying to wrap your head around this big picture of Medicare and what your options are after getting your Medicare activated. For this video, we'll cover it lightly, making sure you compare your Medicare options. This is the part where most people feel overwhelmed, but we'll be sure to make it easy. Once you have Medicare A and B, you have 2 main options. Your first option is going to be Medicare Supplement plans, also known as Medigap plans. If you go this route, you do have to add Part D drug coverage to that. Most of these plans are going to have a monthly premium. And of course, those costs can vary by age and state. The benefits of supplement plans is generally you have access to see any doctor that accepts Medicare. You generally have little to no out-of-pocket costs. And if you go this route, you'll obviously need to add a separate drug plan to help you handle your pharmacy needs. The second option you'll have is going to be the Medicare Advantage plans, also known as Part C. These are going to be $0 premiums in many areas. These plans will cover the same benefits like doctors and hospitals, everything that's required to be covered by Medicare, but often these plans will also include additional benefits like prescription drug coverage, extra benefits like dental, vision, hearing, a gym membership. Usually these plans have provider network. Like most insurances, you may need to use doctors that participate in network. And here's what we do for our clients. We check out your doctors, make sure that they're covered, and we look up your prescriptions and compare costs. We explain the plans in plain English, no jargon, no pitch. We help you pick what makes sense based on your individual needs and, of course, budget. And as a reminder, you don't need to figure this out all alone. That's why we're here to help for free to help you navigate through the Medicare maze, which brings us to step 4, which is canceling your ACA plan. Now, this step is critical, and here's where a lot of people make costly mistakes. I'll help you with this process, but once you enroll into Medicare and select the Medicare plan, whether it's a supplemental or an Advantage plan, we'll want to set up your marketplace plan to cancel as is the last day of the month, the day before your Medicare plan begins. So if you stay on an ACA plan after becoming eligible for Medicare, you could have to owe back any subsidies that were paid toward that plan. And the reason why is because the ACA, the Affordable Care Act, gives you a discount called a premium tax credit, which helps you reduce your monthly premium. But once you're eligible for Medicare, you're no longer eligible to receive these subsidies through the marketplace. Now, this is true even if you don't enroll into Medicare. If you continue receiving subsidies from the ACA while you're Medicare eligible, the IRS can ask you for all of that money back at tax time. I've heard of other people having to pay back thousands of dollars back to the IRS just because no one explained this to them. But not with my clients, of course. I help you manage this process, which brings us to step 5, which is line up the timing so you don't lose your coverage. So you want your ACA plan to end on the day before your Medicare plan begins. So if Medicare starts on October 1st, your ACA plan should have an end date of September 30th. Now, here are 3 different ways to cancel your ACA plan. And the first option is to log into healthcare.gov. You can go in there, you can choose to cancel your plan, and then set a date for the date to be the day before your Medicare plan begins. The second option is if you're already a client of ours, just simply send us an email requesting to cancel your ACA plan as of the date before your Medicare plan begins. My team and I can go into your application and cancel the plan on your behalf. And third, you can call the marketplace and ask them to cancel your plan as of the date requested. And as promised, here's a bonus tip. Make sure you pay your final ACA premium before the plan ends. Otherwise, they may cancel your plan retroactively, and that may cause billing or claim issues for any outstanding bills. So now you know, guys, the 5 steps to transition from ACA to Medicare and avoid IRS problems, penalty-free, or gaps in coverage. If you learned anything new today, please consider giving this video a like. It really helps others find this information too. And be sure to subscribe to the channel. Medicare and insurance guidance is always changing, and we want to make sure we keep you abreast of that information as it comes out. If you have any questions that weren't answered in today's video, feel free to add them in the comment section below. I personally read every one of them. If you need expert advice, consider scheduling a call. My team and I would be happy to walk you through the process of understanding Medicare, your options, and more importantly for this video, how to transition from ACA to Medicare plans. No pressure, just clarity. If you want to watch another video explaining a high-level view of what Medicare is and your options, consider clicking this video here, and we'll see you there. Till then, take care.